Welcome to Native Talk Arizona, Native Health's Native American Cultural Affairs program, presented by Native Health and KRDP 90.7 FM. I'm Susan Levy. And May is National Women's Health Month, an annual observance that aims to empower women to prioritize their health and provides resources for learning about various health topics. And in the studio with us today is Dr. Jennifer Veaco, an MD. She's Native Health's family practice physician. And welcome, Dr. Veaco. We love having you on and always talking about these super important health initiatives.
Thank you so much for having me.
So before we get started, tell us a little bit about yourself. How long have you been practicing and family practice and all of that?
Okay. Well, I've been at Native Health for 3.5 years. And, before that, I did my family medicine residency, which is 3 years after medical school. So I'm a family medicine physician. I'm also a lactation consultant. I love seeing all ages. And that's one of the reasons why I chose family medicine, is to treat the whole family. I do especially enjoy seeing women and children. Currently, I'm pregnant and I have 2 little ones at home, a 5-year-old and a 2-year-old. And so talking about women's health topics, especially this month, is like very close to my heart. It's kind of where my stage of life is at right now.
Oh, congratulations.
Yes.
I didn't know that. That's awesome.
Yeah, thank you so much. I'm like halfway through.
All right. And you have one of each, right, already?
Yes, I have a 5-year-old daughter and a 2-year-old son.
Okay. Be interesting to see what this one is.
Yeah, we'll see.
They're always happy surprises, right?
Yes.
When you have a baby, it's always good, boy or girl, as long as
we're
they're
very
healthy.
excited. Yes,
That's
thank
awesome.
you so much.
All right. So what kind of services does Native Health provide in terms of medical?
Well, we see all ages and all genders. We see preventative medicine appointments. So that's going to be your annual physical, your well woman exam, that type of thing. But then we also see more problem-based appointments. So if someone has an acute care need, whether they have an injury or a cough, a cold, we can treat that. Also managing more chronic conditions. So that's going to be more of like diabetes, high blood pressure, other things where someone needs to take some regular medicine. We have those appointments as well.
So a lot of everything.
A lot of everything. That's what family medicine's all about. I love the variety.
That's pretty cool. And then I know we do walk-ins at Central and our Dunlap location, 8 a.m. to 7 p.m. Monday through Friday. And I know May says 8 a.m. to 5 p.m.
Yes.
People can walk in for those things. Okay. All right. So May's Women's Health Month. Tell us a little bit more. Do you know why May was chosen for that?
So I'm assuming it's related to Mother's Day is in May. And sometimes there are organizations that do like a week-long event that starts at Mother's Day and kind of ends towards the end of the month here. So I think it's very fitting to have Women's Health Month in the month of May.
I agree. So is Women's Health Month, is it to call attention that you should be taking care of your health and getting certain tests, or what do you think?
Yeah, so there's a lot of different aspects of Women's Health Month. There's a focus on health, so not only physical health, so I can certainly talk a lot about physical health being a family medicine physician, but there's a focus on mental health for women, emotional well-being for women. There's also a focus on empowerment for women. So choosing, actively managing your health, making informed decisions about your health care is very important. When we actually have a month dedicated to talk about women's health, it encourages the community to make events, to talk about certain topics related to how they serve that community, and also to provide additional education. So this is a perfect example, is we're having a talk show, we're talking more about not only, women's health is people's health, so having an annual exam is important for everyone, but what are some more specific things that women need to kind of focus on for their health? So there's that education piece.
So at what point do you move from pediatrics, let's say, to women's health? Is that like when you're 18 or younger, if you're sexually active? At what point should you start thinking, okay, you know what, I need to get a well women's exam? And I guess I should back up and say, like, what is a well women's exam for people that don't know?
Well, so with a well women's exam, it's based off of the age of the person who comes in, and then the provider can talk about what certain screening tests or what topics are going to be discussed at that point. In regards to the time, I promote a yearly physical for all ages. So when you're a child, you should be coming in every year for your pediatrician appointments. And then pediatricians will usually see girls up until the age of 18 or 21. And so usually around 18 or 21, now is the time to kind of look for an OBGYN or a family medicine physician or an internal medicine physician that are more familiar with the aspects of women's health as girls mature into women. What are some things that we kind of need to take care of?
So if you get a teen, as a family practice physician, if you get a teen that comes in and she's, let's say, 16, 17 and sexually active, is that when you start talking about like a women's exam, like a pap smear, breast exam, things like that?
So in regards to, if someone is sexually active before the age of 18 and they're a teenager, certainly it's important to talk about safe sex practices. It's important to talk about birth control, being screened for sexually transmitted infections. Now, when we're thinking about more of the pap smear, the mammogram, that's going to come later. It's recommended to do pap smear starting at the age of 21 or when someone is sexually active, whichever actually comes later. So the earliest would be 21, and then mammograms don't start until the age of 40 or 50, depending on what academy you kind of guidelines you follow. Now, with that being said, if someone has family history of certain cancers or other diseases, these numbers might change, but that is kind of the overall recommendation.
Okay. All right. So let's start. So an annual physical, that should be done annually. I take it, since it's called the annual physical. And so for a well women's exam, what comes along with an annual physical?
So with the annual physical, we want to check vital signs. So we want to make sure that heart rate is good, blood pressure is good. We can check height and weight, making sure someone is growing appropriately. We can talk about more diet and exercise, lifestyle modifications, mental health. It's recommended to be screened for depression, anxiety during these times as well. In addition to the talking about more of the lifestyle modifications, it's also related to, we also look at the age. And so at some ages, it's recommended to do some yearly blood work or blood work periodically, and that can screen for diabetes, cholesterol, kidney and liver function, those types of things. There are women-specific preventative tests that we can discuss, such as the sexually transmitted infection screening, birth control, pap smear, and mammogram.
So it all depends on your life stage. So you come in. So is it important then to have a primary care physician or a provider that knows you and you know them?
Yes, absolutely. I feel like that's probably the number one thing that someone can do that's beneficial to their health is get a primary care provider, no matter the age. Because then, I don't expect patients to know when exactly they're due for labs or their pap or mammogram or any of these types of things that we're talking about today. But when you're coming in at least once a year, that's a wonderful opportunity to say, hey, I noticed that you haven't had a PAP for a number of years, or have you gotten your mammogram yet? You haven't started yet. It opens the door to discuss more of these screening tests that are more specific to age, sex, and gender. Okay.
So important that you get a PCP and that you follow up and do it. I know that recently I thought I had been going for a PAP like every year. And I do everything at Native Health except that.
Fair.
Little too close to home, people that I work with. And so I remember calling and I'm like, oh yeah, I just did that. And she's like, no, it was like pre-COVID. And I'm like, oh my God.
I think especially with COVID, the time gap, like people think, oh, I just got that. And then we actually look and it's like, who knows? It's been a number of years, right? I think time can fly without people realizing it. And that's why it's important to try to make it a habit to come every year. I say if it's hard to remember, say, okay, either, first of the year in January, try to make that appointment to do your preventative exam, or you can choose around your birthday, whichever makes more sense for you.
Good point, because I honestly, it was like that whole just 3 or 4 years just disappeared with nothing.
Yeah.
Okay, so tell me, I know you said for a pap smear, you said it starts at age 21, correct?
Yeah, at age 21 or when someone is sexually active, whichever comes later.
Okay, and then done yearly, or has that changed also?
That has also changed, and that's another reason to just talk to your provider, because recommendations change as we get more data as a medical community. So traditionally, previously, we were doing Pap smears every year. Now studies have shown that cervical cancer is very slow growing, and so we don't have to be checking every year. If the Paps have been normal, so let me back up. Let me kind of talk more about what a Pap is. So with a Pap smear, that's going to be a physical exam with your OBGYN or family medicine physician or internal medicine physician who is experienced in women's health. That is going to be a visual exam of the private area to make sure there's no lesions, rashes, growths that are abnormal, checking for any abnormal vaginal discharge, that type of thing. And then there's also an internal exam where there are some swabs that are done, and that checks for infection and it checks for abnormal cells. So specifically, we're looking at cells of the cervix. The cervix is one organ of the female anatomy that's very prone to cancer, especially if someone has the HPV virus. So we do those swabs. If the swabs have been normal and negative for HPV normal cells, then we can space out these swabs, the traditional Pap smear. So from ages 21 to 30, it's recommended to do the Pap smear every 3 years if things have been normal. From age 30 to 65, we can actually space it out to every 5 years if things have been previously normal. Now, if things become abnormal on the swabs, that's the whole reason why we do screening tests, because with cervical cancer, a lot of times it's asymptomatic, meaning people do not have symptoms. And so if we find some things, we can actually treat it before it becomes a further issue.
Okay, so you mentioned HPV for Pap smears.
Yeah.
At what age are those vaccines given? And are those given to boys and girls now, or how has that changed?
Yeah. So the recommendation is all children are recommended to get the HPV vaccine series, boys and girls, because it's both boys and girls who are sexually active who are spreading the virus later on, right? And so even if you have a son, it's very important to get the HPV vaccine, because that is then protecting women in the future. It is recommended to give the vaccines generally in the preteen years, ideally before someone is sexually active, before someone is actually exposed to HPV. If we can give the vaccines before someone exposed to HPV, then they are more likely to be immune to that virus, not catch that virus, and less likely to get cervical cancer, which is wonderful.
So very important to do that and ask your provider.
And there's also an incentive now of, traditionally it was thought of, these are only vaccines that we should give before someone is sexually active. There is an incentive going on, or not necessarily incentive, but more of like awareness and changes in insurance coverage, where if you're an adult, you can actually still get the HPV vaccine. I believe up until the age of 45. So if you haven't gotten the HPV vaccine, if you were kind of out of that window, older when the HPV vaccines came out, definitely talk to your provider if you'd be interested in kind of getting those catch-up vaccines.
And how does HPV affect older individuals? I know, isn't there a higher incidence of males with oral cancer?
Yes. So HPV, traditionally speaking, we think it increases the risk of cervical cancer. That's like definitely very well known, and it's the most common cancer that it affects. With that being said, HPV can affect or can increase the risk of penile cancer, anal rectal cancer, and oral cancers, because these are all sexually active. In regards to the oral cancers, we see more of like head and neck cancers related to HPV. So there's a lot of cancer in and of itself is when the cells grow abnormally. It can be related to lifestyle. It can be related to exposures, toxins, and viruses, and other infections too. But specifically when we're talking about HPV, if the virus is present in those cells, it makes those cells misbehave and can increase the risk of those cells then misbehaving, abnormally growing, and turning into cancer.
Okay, so important to check with your provider on HPV.
Yeah.
All right. Then I want to back up. You talked about Pap smear. Is it important to do like breast self-exam
Mm-hmm.
at any age, all ages, and how does that tie in with the mammogram if
Yeah.
you don't want to do that?
I do recommend being familiar with your body, and that's with anything happening with your body. So, being familiar with what kind of moles you have, what are typical freckles, what's a typical weight for you, and also being familiar with your breasts as well. Certainly things change as you age, but you are the most familiar with, well, that's an abnormal lump, or I feel like this breast is more full, or this breast is more tender, and now I'm having nipple discharge, and that's abnormal. So you yourself, you're your expert in knowing your body and what's abnormal. And when you're noticing something that is new, certainly talking about it with your healthcare provider is key.
Okay, so that being said, so I know way back when, pre-COVID, and I know things have changed a lot, is it still recommended that you do like a breast self-exam every month?
So those recommendations have changed kind of based off of data. There's not really a set guideline on a certain interval you should be doing your self-exams. It's more about being familiar with your body and if anything is changing. That's also why the recommendation for healthcare providers doing the breast exams has changed. Traditionally, it was thought of to do a breast exam. The healthcare provider will do a breast exam for screening purposes every year. But studies have shown that actually it's the patient that knows what's normal, what's abnormal. And so they're the ones that are actually finding things more accurately than clinicians for the actual self-exam. Now, this is separate from mammograms, which is radiology where we're able to see more things. But there's not like a guideline or an interval. It's more about checking up on your body.
Okay, so that's also changed. Okay, So mammograms, and those you said begin depending on the school of thought that you're under, right? The provider, 40 or 50?
Yeah. So there are different societies that make recommendations for cancer screening. There's the American College of Gynecology, ACOG. There is the AAFP, the American Academy of Family Practice. There is the American Cancer Society. So all these societies look at the data and they make recommendations based off of how they interpret the data. Depending on what society you follow, it's recommended to start mammograms at age 40 or 50 every 1 to 2 years up until the age of 75. With that being said, if someone has family history of certain cancers, especially family history of breast cancer, we might change these recommendations or guidelines. So if someone has a family history of early breast cancer, meaning if someone has in their family an individual who was diagnosed with breast cancer in her 40s, well, then we're actually going to want to screen that individual with a mammogram in her 30s because we want to catch it before it becomes, an issue. We want to catch it when things are really tiny and we can actually treat it and be done with it. And that's why it's important to do screenings frequent and early.
Why do you think there's such a reluctance or people think it's so painful to get a mammogram? I don't think it's, I don't know.
Well, and I think people have the same fears in regards to pap smears, right? At the end of the day, it is an intimate procedure or imaging study where, you're going to be seeing someone that is not a family member and they're going to be, checking up on things. So I think that can be nerve-wracking for some people, and I understand that. But we have these tests for a reason to try to keep our patient population healthier overall. And if you have concerns, questions, please talk about it with your primary care doctor. There's other types of screenings we can consider doing. So there is self-swabbing that women can do, self-vaginal swabs, and that can certainly screen for some things. And if someone is worried about having a provider do that, there's also ultrasound if someone is worried about mammogram and kind of what that entails and like the compression of the breast. That might be appropriate for some people. There's MRI that might be appropriate for some people. So we can kind of try to think more patient specific. If someone comes in and shares some concerns or questions, we can try to tailor the medicine specific to them, because healthcare, it should be universal, but it should be very patient specific.
And that's probably why you're so amazing and popular, is that you think about those things rather, I don't know, and kind of think outside the box for each patient and what's best for them. Okay, so we talk about mammograms, we talk about pap smears, we've talked about yearly checkups, and making sure you get a PCP, which is the most important. And then what about, do they still recommend doing some of the tests for, osteoporosis? Sorry.
Yeah. So that's another thing that's going to be the osteoporosis screening, or what's called the DEXA screening. That's going to be more specific to your risks of getting osteoporosis. So there's a calculator that a family medicine physician can utilize, where, we put in your age, your risk factors for osteoporosis, which can be a number of different things: medications, weight, previous fractures, family history. And we can say, okay, should we screen someone early? Meaning, should we do a DEXA scan? Should we check essentially the density of the bones early, or should we wait until 65 or that type of thing? And so that would be another thing to discuss for women who are typically above the age of 50. We start thinking about it, but once again, if someone has some certain medical conditions or family history, we can think about if things should be done a little bit earlier than that as well. But that's kind of when we start doing those calculations to see when should we be doing that screening test. So with the DEXA scan, that's going to be another imaging study that checks the density of the bones, essentially how brittle or how strong your bones are and how likely they are to break if you have a fall. And if someone has more brittle bones, we can talk about supplements like calcium, vitamin D, and there are specific medications for osteoporosis as well.
Okay, good answers on those. All right, so you just mentioned vitamin D. I know I hear different things about living in Arizona, and that most people, because we use a lot of sunscreen out here, we don't go out in the sun a lot. We try not to. Is vitamin D, is that a test that's readily done, easily done, readily done, often done, and or should you be getting a blood test for that, or a test to see if you should be taking some supplements?
So it's not recommended for everyone to be checked for vitamin D deficiency, but there are a lot of reasons why we should check vitamin D on the lab work, which is blood work. You would check a vitamin D level with a blood work test. And I see a lot of vitamin D deficiency in Arizona. You're right. It certainly can be related to sunscreen use, which I hope people are using their sunscreen when they're out and about to avoid skin cancer. But also, I think it's related to the fact that we're so conditioned to be indoors, especially during the summertime. It's so unbearably hot, and we want to stay indoors out of the heat as much as possible. So we're not really getting those direct sun rays. As you kind of hinted to, vitamin D ideally should be from our diet and also from the sun. So when we have sun-exposed skin, then the sun rays will touch the cells in our skin. Our cells will do something magical and start creating some vitamins for us, including vitamin D. And we do need vitamin D to make healthy bones. We need both vitamin D and calcium. So if someone has some risk factors for vitamin D deficiency, we can certainly check that on the labs. And if things are low, luckily there are some vitamin supplements we can recommend. And we can also talk about vitamin D-rich foods.
Okay, another good answer, very important. I know a lot of people that do take vitamin D supplements because, I try never to go outside during the day in the summer.
Yeah, well, and I think it's something that so there's a couple different supplements that are more specific to women. Vitamin D can be one of them, but also what I'm thinking about would be iron and folate. So iron can be low in women simply because we are losing blood more often. If someone is having their menses every month, if someone is having their period, you are losing blood. And what's important with the blood? Well, you need the vitamin iron for energy and to make red blood cells. which are important cells in our blood that transport oxygen to the rest of our body. So I see low iron in a lot of women, and the symptoms can be very, what's the word I'm looking for? Just non-specific. It can be fatigue, poor sleep, changes in hair, skin, and nails, energy overall. And so that would be a reason to check on iron and supplement appropriately. Now, luckily, in a lot of women's multivitamins, it has iron in it because the multivitamins are made with the idea knowing that women are more likely to be low in iron because of the periods. Another supplement that is often in women's multivitamins and prenatal vitamins, and rightly so, would be the folate. Now, folate is very important for pregnancy and fetal development, and oftentimes these things, how the fetus is maturing is we need the folate before we even know that we're pregnant. And so by taking like a women's multi or a prenatal vitamin, it might be perfect for a sexually active woman to be taking that readily, just to be, keeping up on her vitamin stores. Now, supplements, I certainly recommend discussing with your provider what supplements you want to take or you're currently taking, because some supplements can interact with medications and some supplements can be like too high of a dose and it can actually be toxic. So please know that, with my recommendations, please double check everything with your provider so that things are very specific to you and your own health.
We'll continue Dr. Jennifer Veaco's interview after this short break. Support for KRDP 90.7 FM comes in part from Native Health, with 2 locations in Phoenix, 4041 North Central Avenue, Building C, near the corner of Central Avenue and Indian School Road, and at 8800 North 22nd Avenue. Native Health is also located in Mesa at 777 West Southern Avenue, near the corner of Southern Avenue and Extension Road. Native Health provides primary medical, dental, behavioral health, WIC, and wellness services for the urban Native American community. For more information, call 602-279-5262 or visit our webpage at nativehealthphoenix.org. Native Talk Arizona returns after this song. You are listening to Fight Like a Girl by Ray Zaragoza.
Grandma Nature, Mother Moon, show me what to do when they are taking our rights away, policing our bodies. Easy, easy we go. It's repeating on and on. Take me to the water, take me to the snow, where all the souls of our mothers had to go. Take me to the street sights, teach me your battle cries. Take me to the front lines of the war, to fight like a girl.
So you didn't briefly talk about it, but you talked about getting your period. So what about menopause? So is that an important time to come to your physician or your provider, talk about that, or how does that work?
Yes, please come, because there's lots of things that we can do to kind of help with those symptoms. I think a lot of times women will suffer in silence, thinking this is part of, our natural aging process. But thankfully, we have innovation in medicine where there are some FDA-approved medications and also even more of integrative medicine things that we can discuss that can help with these traditional symptoms that are very bothersome with menopause. Now, menopause, the average age of menopause is around the age of 50 for women in the U.S. Now, that being said, it can range anywhere from 45 to 55. Some women will get menopause a little bit earlier. Some women will have their symptoms much later. A better idea, or I guess estimate, of when you will be going through menopause is if you have some sisters, or if you know when your mother went through menopause, because it's also very genetic related. So if you know that your mother went through menopause early, or your sisters are going through menopause early, that is kind of going to be your expected age as well. So if you're having symptoms of menopause, please come in and we can discuss what those symptoms are and how we can better treat that.
Okay. Now, are there any signs or symptoms if somebody's experiencing anything that they should make an appointment earlier and not wait?
So with what we've discussed, it's all about, previously with what we've discussed are screening tests. Now, what that means are screening tests are tests, whether they be blood work, procedures, imaging studies. These are tests that are going to be designed to catch things early before they have symptoms, okay? So if someone is having symptoms of anything, then we no longer follow the screening recommendations. We no longer say, oh, well, you just had a mammogram. Too bad you have a breast lump. We're still going to wait the 2 years. It's like, no, we want to see what's going on. A couple examples. That would be one of them. If you have any breast changes, no matter what your mammogram said previously, if they are new breast changes, please come in and we can see if we need to do another mammogram or an ultrasound or any other test. Same thing with pap smear and well woman exams. So if someone is having irritation, vaginal discharge, pain with sexual intercourse, these are things that you should not be suffering in silence about. Please come in. We can see what's going on and hopefully treat that and make you be feeling better. Another thing that I see that women will delay seeking care is problems with their periods. So if the periods are very heavy, painful, if they're missing work or school because of their periods, that is you should not be missing work or school or having very heavy bleeding without discussing it with your provider to see if we can kind of better see what is going on. If is there something more going on than just hormones? Should we be checking on a couple things? Should we be treating it with other medication to make you be feeling better so you can live a more productive life and not be hindered by having your monthly cycle? In regards to older women, so we typically think about menopause is when someone hasn't had a period for over a year. Then we can say, okay, they've gone through menopause. Now, with that being said, periods can become irregular for 2 years prior to things kind of spacing out for that full year mark. So menses can be irregular for 2 years. You can still have some menopause symptoms before not having a period for over a year. So if you're having symptoms, please come in. We can discuss what we can do to kind of make you feel better. If someone has gone through menopause, meaning you haven't had a period for over a year, and then you suddenly start getting vaginal bleeding, that is not normal. Okay, don't think that your period has come back. That is not normal. Please come in. We need to be screening for infections. We need to be screening for abnormal cells, cervical cancer, etc. So please come on in if you have any concerns.
Good recommendation. All right, so since May is Women's Health Month, what's an easy small step that women can take to get like kind of on the right track or to improve their health? Would it be exercising? Would it be making an appointment with the provider? Would it be a better diet, stop smoking? What recommendations? Easy, little, tiny things that people can do.
Okay, well, of course, I'm going to say all the above from what you just listed, but from what we've talked about, we've talked a lot. There are a lot of health issues that affect people in general, and there are more specific health issues that affect women. And I want you to be aware of your own health and your body and how things are changing. And a good way to kind of stay on top of your physical and mental health would be having a primary care doctor, because it's not your responsibility to keep track of all these things and be your own provider. And I think a lot of people, especially thankfully with the technology, you can Google things and be reassured or not be reassured.
Probably not be reassured.
Right. But
going down that rabbit hole.
I know. But, that's why people spend many years in school and in training to try to offer expert consult to patients, right? And so that would be my number one recommendation, is have a primary care provider that you can go to and discuss issues with and discuss screenings about.
Okay, that's your number one. And do you recommend, so if you wake up at 2 a.m. and you're like, I don't know, and you're Googling things, that's probably not the best thing. You should be seeing a provider and not using the computer to tell you.
Yes, because, I've seen it both ways. Certainly I've seen people come in and they think that they have something rare or very deadly, and it's like, okay, no, it's actually not that. But I've also seen, thankfully, yes. But I've also seen it where people have Googled things and they've felt falsely reassured. They think, oh, it's probably just this, and this. And it might be something more. So, yes. I love Google. I love AI for a reason. It makes our lives a lot easier in a lot of ways, but it is not, it should not be your main healthcare information means, right?
Especially AI now.
Yeah. And I think so. One thing that I love about Native Health specifically and community health centers is we try to make things affordable and accessible for patients. So a lot of times if someone has insurance and they go to they have a preventative exam, well, that should be covered by their insurance. You shouldn't be paying a copay. Now it might be a little bit different if you have some problems that we're trying to work up, or labs might have a different type of copay or that kind of thing. But in general, insurance should be covering preventative tests and preventative appointments. Now, if someone does not have insurance, thankfully, Native Health, we have a sliding scale option, meaning that you don't have to have insurance to see us. Please come in. We can offer you cash price options that are going to be tailored to your financial situation, that are proven to be affordable in your financial situation.
Okay. Totally true. Native Health does, I think, a great job, as do all community health centers, kind of making sure people are taken care of. Okay, so let's go back to easy, small steps. 1, don't use AI or Google to your provider. 2, exercise, still same recommendation. You should be doing something every day, or stretching or walking or...
Yeah, so in regards to exercise, the recommendation is 150 minutes of moderate exercise a week, which, breaks down 150 minutes a week. What is that? That's going to be
20 some odd minutes a day.
Yeah, or 30 minutes a day, 5 days a week, right? Or if you're doing vigorous exercise, that's going to be exercise that you can't hold a conversation doing. So that's going to be your HIIT training, your boxing, your swimming. Vigorous exercise recommendations would be only 75. So you can choose one or the other, or a combination of the two. With that being said, the other type of exercise that's recommended would be weight training and strength training. And this is very important for women. I think some women will have the misconception of, I don't want to do strength training. I don't want to get big or bulky, or that's going to change my figure in a different way. No, having good muscle tone is very important to stay physically active and mobile as you age. it also helps prevent osteoporosis, because if you're doing those strength training exercises, if you're putting load and weight on your bones are going to get the message of, oh, I need to get strong. I need to take vitamin D and calcium and make more bone and make my bone denser and thicker. And so when you're doing these strength training exercises, especially for women, that's going to prevent osteoporosis in the future.
And then that being said, what about balance?
Yeah, so the strength training, the balance, that can oftentimes go hand in hand, right? You're trying to do some balance exercises when you're doing some weightlifting, or yoga is going to be a good option where you're doing some of those body weight exercises, but you're also trying to maintain certain poses. So yes, the goal is strength training twice a week, and that can be incorporated in the balance piece as well.
Okay. Any truth to 10,000 steps a day, or is that just kind of random and no longer relevant or thought of or accepted?
I think that's a good goal. When I look at kind of what the American Cardiology Society talks about, they have more of the number recommendation. But hey, if you're getting in a lot of steps, that's going to essentially count towards your 150 minutes of moderate exercise a week. So if you're getting in a lot of steps, the two are not mutually exclusive.
Okay. I do have my watch every day and my pedometer.
Telling you to stand up too and take a break,
move,
take a stretch. Yes, very important to maintain mobility.
But definitely getting those 10,000 steps every single day, even if that means walking at night and getting more in.
Now, if we're wanting to talk more about exercise, there was a very interesting study that showed, okay, what is more effective in longevity? So, what is going to help people live a longer life? And they were looking at, is it all related to weight? Is it maintaining a healthy weight, looking at an appropriate BMI or body mass index? Or is it simply being active? And how many minutes of activity are you getting in a week? And it's the active group that live longer and stay mobile for long, because when we're aging, ideally to have a good quality of life, we want to be as independent as possible for as long as possible, right? And so it's actually, yes, weight's important because weight can affect a lot of health conditions, but staying active, doing that exercise, whether it be moderate or vigorous exercise, that's actually has more emphasis and more weight, pun not intended, to help you live a longer life. It helps longevity more so than just healthy weight.
Okay, so move more,
Yes.
Get up and move.
Yes.
Okay.
Mm-hmm.
All right, so I know that we had you on a while ago, and we were talking about certain foods that you should eat or not eat. And I believe one of the ones that you thought people should decrease would be processed foods and processed meats, if I remember correctly.
Yes.
Is that still true?
Yep, that's still true. Processed foods, especially processed meats, that's going to have limited nutritional value. It's also going to be digested more in a difficult fashion by your digestive tract. You are made to eat whole foods. That's how we were, evolutionarily designed, is eating whole fruits and vegetables, eating whole grains, eating unprocessed meats, meaning meats that are not made into, hot dogs and sausages and lunch meat and that type of thing. So when people ask, okay, what is the best diet to follow? Well,
Like Mediterranean or...
So there's a lot of these names that are all like very similar. So there's Mediterranean, there's anti-inflammatory, there's the DASH diet, the cardiac diet. What do these diets all have in common? Well, they're all promoting lots of fruits and vegetables, more fruits and vegetables. When you are eating carbs, trying to choose a whole grain option, and limiting meat. There are other ways to have healthy protein that can be plant protein or chicken, fish, more of the leaner meats. So there's not like a specific name that I go off of. I guess if someone has a specific disease process, we can talk more of a specific meal plan related to that. But if someone's to ask me generally what's the best one, it's just going to be more fruits and vegetables, trying to eat whole, trying to eat whole foods, whole grains, less processed.
Okay. Now that we're talking about diet, let's talk about water.
Mm-hmm.
I know that it used to be a hard and fast rule, like 8 glasses of water.
Mm-hmm.
What, eight glasses at 8 ounces each at 64 ounces
Yeah.
a day. But now I think that's changed also. And what about being in the heat?
Mm-hmm.
So, do we need to drink more? Does that mean you should have sports drinks or water with lemon?
Mm-hmm.
Or what do you recommend? Not women specific, just people in Arizona.
People in general, right?
Yeah.
Well, because women's health is people's health. So
Right.
that's why we're still talking about this.
Right.
And so when we're talking about hydration, yes, in general, it's going to be the glasses of water you mentioned, or 2 liters a day in general. Now, someone who has kidney issues or who has other disease processes, that those numbers might change, in which case talk to your doctor. If you're out in the heat, though, something to be aware of is you are sweating and you are losing water, not only water, but electrolytes, the salt that is in your sweat. If you are very sick and you're having lots of vomiting, diarrhea, you are losing not only water, but you are losing electrolytes, the salts. So if you're going to be out in the sun for a while, you're going to be sweating a lot, and you might not even realize that you're sweating a lot because it's Arizona. It's a dry heat, right? That's why a lot of us live here, is we don't feel super sticky and icky. The sweat evaporates so quickly, thankfully, but you are still losing that salt, and so it's important to try to replenish that. Now, sports drinks can be a good choice for a lot of people, for I would say probably most people. But something to be aware of is those sports drinks do have sugar in them often. So if someone is diabetic, we need to choose, maybe a sugar-free option sports drink. If someone has kidney disease, we need to be a little bit more cautious about the salt, because we want to stay on a low-salt diet for people with kidney disease. I don't recommend salt tablets because that can be a lot of salt at once. I would recommend more of those like electrolyte drinks, the liquid IV, the Gatorade, those types of things. Or if you're going to be ideally having healthy snacks with the water, that counts too, as replenishing some of those salts. So having some foods that have some healthy salts, some sugar for energy, like fruits, trail mix, those types of things will replenish what you're also losing. So it's important to, yes, water is important, but the electrolytes are important too if you're going to be out in the sun.
Okay. Good answer, because I don't like those sports drinks.
Mm-hmm.
So one thing I want to mention, Dr. Veaco, I know that we have patient enrollment specialists that can assist with access enrollment, seeing if they qualify for the discount fee program, helping with the Affordable Care Act, so the health insurance marketplace, and private insurance. Did I miss anything? No?
We have social workers too that can help, resources. If someone has concerns about, housing, food scarcity, being evicted, domestic violence, we have social workers and a team of people willing to help, whichever, because there are a lot of things that can affect overall health, right? It's not just exercise, nutrition, coming to the doctor. It's like, can you afford your rent? Are you unsheltered? Are you, do you have access to food? Do you have health insurance? So if you have any of these concerns, please bring up these barriers with your provider, and so we can actually act upon them and try to help.
That's why you're the best. It's really the best.
But yes, we do have professionals here that can help people enroll into insurance. So if you are uninsured, but you might qualify for access state insurance, we have people that can help fill out the application. You might not know, we might not know, you might be on the borderline on if you qualify, but we will still fill out that application to confirm, yes, we can get you on, or no. There are certain limitations to make you accessible for that coverage. If you don't have any insurance, if we've tried different things to get you insurance, we have certain funding that we can still support you and try to see you, and we have the sliding scale option. So That would be, some cash pay options related to your income and family size that we try to make very affordable and reachable for people.
That's super important because, they might have children and they might have kids care, be eligible for kids care.
Yep.
And, cash assistance, food stamps, which is SNAP, all different kinds of programs.
Yeah, WIC.
And WIC, and then you'd qualify, if you're pregnant or have a child under 5.
Yep.
All right. Thank you so much, Dr. Veaco. Again, it's Women's Health Month. And if they want to reach the medical department, you can call Native Health at 602-279-5262. And I can't tell you how much we appreciate you, your expertise, your guidance, your empathy, your wisdom. I always just love chatting with you.
It's been fun being on, and thank you so much for inviting me back every time. It's always fun to talk about a new subject and to try to promote education and ultimately women's empowerment this month to make your choices.
So happy Women's Health Month. So thank you.
Thank you for listening to Native Talk Arizona, presented by Native Health and 90.7 FM KRDP. Our executive producer is Susan Levy. Sound engineer is Javier Quiroga. We hope you will tune in again next week. If you have any questions, please reach us at nativetalkaz@listentokrdp.com.